Good afternoon, my friends. The doctor is in the house. Welcome back to another episode of To Your Health with Dr. G on this great Wednesday. Hey, everybody, we're still in the middle of my Women's Health series, and I'm so excited to welcome everybody back to the show. And really, what we're doing now is during this month, we're just talking about ways to stay engaged, ways to create awareness, and ways to make a change for the positive, a change for the better in the lives of women everywhere. And so I was so excited to have a successful show last week on nutritional and fitness foundations, but I'm so much more excited today to continue to talk this conversation up. We're going to be talking about focusing your mind and really with the hashtag in the stigma. So during the show today, I'm going to keep saying that word, that hashtag reference that in the stigma, because it's such an important thing that we're going to be talking about. So again, today's show is all about just supporting, creating awareness, and hopefully creating more engagement. And as we continue to create engagement in the lives of women everywhere and their families, we can continue to move the needle when it comes to living healthy and happier lives. Again, my name is Dr. Mark Gomez, board certified internist practicing out of Edward Hospital in Naperville, Illinois. You can check me out on my website, www.drmarkgomez.com. You're listening live here on IntellectualRadio-Com on this great Wednesday. So here's how the show works, of course. We're going to meet my guests, Dr. Kate Johnson and Katie O'Donnell in a few moments. But I'm just so excited because, again, this whole series is about opportunity, equity, and, again, continuing to move the needle as far as health is concerned. So before we get started, I do want to make sure that I read you guys a quick little disclaimer. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So we're here today on this Wednesday talking about health, in particular talking about focusing your mind and talking about some of the stigmas that are there and what we can do in this country, in our lives, to help create opportunity and in the stigma when it comes to mental health disorders. So without further ado, I just want to welcome my amazing panel to the show. For those of you that are new to the show, each week what I do is I ask my panelists a ton of questions. They give us their honest answers. We take those answers, of course, and we hope that you guys that are listening apply them. You talk to your primary care doctor. You have this discussion. We don't want this discussion today to end today. We want this discussion to be part of the everyday vernacular, every day talking about opportunities as we continue to create awareness and health. Remember, it can't just be one person that can make the difference. We have to make difference together, like-minded individuals coming together with a common goal, and we will make some serious changes. So the show on the format today, besides meeting my guests, we're going to go through some questions. I love that at the end of the show, towards the end, we're going to do my lovely rapid fire myths versus facts to really set the record straight when it comes to health. And so, again, I'm so excited to have my Women's Health series, part 2, Focusing Your Mind. I want to introduce my first guest. She and I have known each other for a long time. She has been on this show multiple times. I mean, you are a fan favorite. Actually, both of you guys are fan favorites today because you both have been on the show. But again, I trust you both are expert colleagues. My expert colleagues, you're both my friends. And I think you both can convey the passion and a message of encouragement, that compassionate encouragement, that kindly encouragement that's needed to continue to have success in your health. So my first guest, she and I went to medical school together. I'm going to reintroduce her, Dr. Kate Johnson. Dr. Kate Johnson is a great friend. Let me read you her credentials because the credentials are real. Dr. Kate Johnson, assistant professor, board certified adult and child and adolescent psychiatrist, Loyola University Medical Center, www.loyolamedicine.org. Check her out there. Dr. Johnson, welcome to the show.
Hey, it's good to be back.
Hey, Dr. Johnson, why don't you just give us a brief background? Obviously, I just spilled the beans that you went to Loyola Medical School. We went together, but spill the background again on your background. Where did you do your training? Where did you do your residency, et cetera, et cetera?
So, fun fact, I actually started out in obstetrics and gynecology. I was doing my residency there, and then I decided psychiatry was a better fit. And so I switched, and I did both my residency and my child and adolescent fellowship at University of Chapel Hill. Go Heels.
Go
and
Heels.
Yeah, but I also did in my fellowship. One of the things I did was a concentration in mother-infant bonding. We have a perinatal inpatient unit down there, the first one in the country, and so I did a lot of work on that unit and really kind of had a focus in women's mental health because of.
Excellent. And then I want to ask you this question, a follow-up question. We're talking today about just the stigma out there. Maybe give us a couple opening thoughts on things. Obviously we live in, mental health is still stigmatized in our society, even though we've gained more awareness. But maybe give some introductory comments, because you go around, you lecture, you teach. What does this theme mean to you today, especially when it comes to women's health?
I think it's so important that we really start having discussions over and over about the stigma that is attached to just mental well-being, much less mental illness, right? And it's very real for both men and women, but it's also very different. So I think we need to talk about both, and we need to talk about them together and individually.
Excellent. Well, thank you, Dr. Johnson, for coming on the show again. This is awesome. Third time's a charm, but it worked out every time.
Brilliant.
Again, every time's been great. So I think I thank you for coming back to the show. My next guest, I've known her for a long time. We work together. It's great. And you entered my life a few years ago, and we're together part of originally a pilot project at our medical practice, and really to have an integration of behavioral health into the primary care setting, and it's been ridiculously successful. And so Katie O'Donnell has been on this show before. She's also a fan favorite and just an amazing practitioner. Let me read you her credentials, because we only have credentialed individuals on this show because it is a medical show. But no, we're talking some really good stuff. So we have Katie O'Donnell. She's a LCSW CADC, licensed clinical social worker and certified alcohol and drug counselor with Linden Oaks Medical Group, www.eehealth.org. Check her out. Katie, welcome to the show.
Hi, thanks for having me back.
Hey, Katie, give us a little bit about your background and where you do your training. How you got into this field, and really a couple opening statements on why do you think this topic is so important today?
Oh, sure, absolutely. So I also went to Loyola. That's where I got my master's in social work.
Loyola in the house today, across the board.
Absolutely.
I know, it's great.
And through there, I did several rotations, one in Cicero at a community health center that worked with individuals with developmental disabilities. And then I also did my second at Alexian Brothers Behavioral Health in their chemical and addiction medicine program. So I have lots of experiences in different walks of life, which I've been very appreciative of. In terms of women's mental health, I think it's incredibly important. I really like how Kate phrased it as just mental well-being, not just diagnosed illnesses. I think women are really expected to be Wonder Women. And as much as I want to say, yes, I totally am, I feel like we also need to have that dialogue that it's okay to have that vulnerability too, and make your own self-care and well-being a priority.
Excellent. Well, thank you very much, Katie, for coming back to the show. So what we're going to really frame this discussion around, of course, is really, what can we do as a society to help destigmatize mental health challenges that women face? And then what are some of the unique challenges after addressing them? What are the unique challenges, but what are also some of the unique solutions that are out there when it comes to addressing a woman's own mental health illness? And it's interesting when I think about the statistics that are out there. We obviously know millions and millions of women in this country suffer from mental health disorders. Some of those women that have those conditions are working with practitioners. Some are not. And really what we want to do is make sure that everybody has access to proper mental health services, just like with any medical condition. As an internist, we always talk about in the medical field, timely diagnosis is paramount, because the options for treatment are so much more available. And really, when I think about mental health, and I think about my role as a primary care doctor, but also working with you two as specialists, is that you two are part of. I mean, you're part of the team. Anybody that's out there, you've got your team. I mean, you should have your primary care doctor. I talk about that all the time, for just general well-being, physical health, mental, but also having the collaboration. And I think that's an important thing. I feel like though the challenge is a lot of times we're so siloed in our practices. So I want to start with that first question for Dr. Johnson. How do we try to just maybe kind of close the gap amongst practitioners to hopefully help address mental health in women?
So I think, the very first step is what we're doing right now, right? Like we start opening these dialogues, we start talking about what this means. We start talking about like, it's okay to talk to your primary care doctor, it's okay for your primary care doctor to say, you know what? Let's bring in an expert here. Sometimes you just need a specialist, right? And nobody questions that when you send them to a cardiologist. But when you say, oh, I want you to see a psychiatrist or a therapist, oh my gosh, suddenly it's like, doctor, you think I'm crazy, right? Like, and the fact of the matter is, I mean, you and I went to medical school together, right? Like, I'm as much an MD as you are.
Absolutely.
I just have different training.
Yes.
And so I think that's part of it is just getting people, both patients and doctors, to kind of have those conversations. And then the other thing is, you're right. I mean, we as a profession right now are still very siloed, and that's starting to change. And I think we encourage that change. I think we encourage a lot of communication. I think we, like one of the things that I do in my many hats that I wear is I'm actually embedded in a primary care office one day a week, where I'm, sitting in the clinic with the primary care docs, and I'm seeing my own patients and doing my own thing, but they can come over and say, hey, what do you think about this? What can I do? Should I do this? Is this a bad? And just even beginning to have those conversations and have that like FaceTime, right? And that ease of conversation really opens a lot of dialogues.
Excellent. I know for us, and Katie can please expand on this one. Part of the goal when we initially connected was to just kind of get rid of the initial stigma of having somebody with mental health disorders go to a mental health facility, which has its own connotations to it. And it's like, well, why don't you go to a place where you're normally comfortable at, which is your regular doctor's office? Can you talk about a little bit more about an integration standpoint from your perspective?
Sure, absolutely. And that was kind of the spirit behind integration, is we really lose a lot of people by just providing referrals. So you can give handouts all day long about psychiatrists, therapists who you feel like would be a good fit for people, but the likelihood they're going to retain that piece of paper, that they're going to follow up with those providers afterwards, is really low. So when there can even be this warm handoff between a primary care doctor and individual therapist, a social worker, what have you, we can kind of make sure we're scheduling in the room, answering questions, like putting face to name. It makes it a little less intimidating. And again, like you said, when people are coming to a place they're already familiar with, they trust their primary care doctor, they know the people who work there, it's a little bit easier to come in and say, well, I'm not going to go see a shrink. I'm going to go see my doctor. I'm going to my doctor's office, which in my opinion, I feel like behavioral health really needs to be seen as medicine, as healthcare, because there really isn't a difference between, trying to get healthy in terms of mental and emotional problems versus, pulmonary or cardiovascular. So that's where I kind of like how we can kind of provide that integration and start that dialogue and kind of take away maybe people we would miss because of some of those stigmas.
Excellent. So Dr. Johnson, we're here talking today about really what's out there for women's health, and again, destigmatizing. Why don't we start out like this? Everybody out there that's been listening and watching, you've been hearing, you've met my guests, you've been hearing some introductory remarks, and we know that this is a real challenge. But nobody's raising the white flag of surrender. We want to do this together. As practitioners, we've all taken an oath of some form. I don't know what the oath was for a licensed clinical social worker, but I'm assuming it's almost like the MD oath. But you've taken an oath regardless, Katie, to provide a service because you're doing this because it's your calling, it's your passion, it's your purpose. And so the challenge is, when we think about mental health, is sometimes people may not realize that purpose that they have, and so, or they may not be able to express it. So let me ask this to Dr. Johnson. We know that mental health is part of just your overall health as well too.
Absolutely.
And we want people to live healthy lives. You used the word well-being, mental well-being earlier. How do we now, in addition to talking about this like this, how can we give some practical advice? How can we just basically say, all right, if somebody's out there and they don't know that you exist, or they don't know that Kate exists, how do we get people to know that, first of all, you guys exist?
Yeah. I mean, this is a good start. Here we are. No, I think, and I think because as we've been discussing, like a good place to go is your primary care doctor, and just say, like, I'm struggling with things. This, or not even I'm struggling. I would like this to be better, right? Okay. Like, I think we often wait until, everything's kind of falling apart. And again, this is part of the stigma, is that women should be able to handle it. We should be superwoman. It should be, and so it's like, as things are falling through the cracks, you're kind of having that same dialogue of yourself of like, no, I should be pulling it together. I should be pulling it together. Nonsense. No, you shouldn't. If you broke your arm, if you had chronic headaches, you would go seek help for it. This is just the same thing, right? And we're not like people still, I mean, how many years ago was this movie? But people still think One Flew Over the Cuckoo's Nest. They think, again, doctor, you think I'm crazy. They're going to lock me away no. I mean, even inpatient facilities, right, are there to help. They're there to heal. It's not this crazy house that, and just again, starting to kind of realize that like this happens to everyone. You don't have to hold it together until the last minute. You should think about this as, if you had a chronic cough, you'd go see your doctor. He'd send you to a specialist. It's the same thing. And furthermore, right, like we talk about how things are kind of kept in silos. The body doesn't get that, right? Like your body is your brain is affecting your body is affecting your brain. It's all working in this beautiful symbiosis. And there's no reason to say, oh, we're not going to pay attention to half of that and expect the other half to get better, right? So, I think just starting to kind of even just pay attention, right? And understand the resources that are out there, and like people see therapists. I have a great therapist, right? And yeah, like I often say I am a good therapist because I have a good therapist,
Excellent.
So people do, it's not a big deal. It's part of just getting to the place you want to be and living your best life. And that is not even okay. That is awesome.
That is well. Thank you for clarifying that. I mean, the energy is so real, and we want to build off this energy, this positivity. Let me ask you this, Katie. We're talking about mental health very, very broadly, but let's get a little more specific. What are some of the common mental health disorders that women are facing today? What are some of the diagnoses that you're seeing?
I'd say, especially in a primary care setting, I get a lot of anxiety disorders and major depressive disorders. That's probably number one. And I'd actually kind of go a little bit further and say a lot of the people come in with adjustment disorders. So the difference between an adjustment disorder and major depressive disorder, anxiety, is they're in response to a stressor. So I see people who are having a major life crisis or something going on, or even a diagnosis, a medical diagnosis. And they have this period of anxiety symptoms, depressive symptoms. And the difference between an adjustment disorder versus another diagnosis is it's only about 6 months. So sometimes that can turn into an anxiety disorder, can turn into major depressive disorder. But sometimes if we get that intervention in, we can kind of resolve those symptoms, give people tools, other options to work with, and they don't develop into some of these other illnesses. So when we're looking at kind of baseline what people come in with, I'd say anxiety and depressive symptoms, and they can manifest in so many insidious ways that sometimes we don't really realize, oh my gosh, this is what's going on. I even would say, how many tests have you run for patients when they're trying to rule out all these different diagnoses? And at the end of the day, we're looking at anxiety or depression.
Excellent. Thank you for clarifying that. You know what I want to do? I want to take a step, even a further step back. You guys just heard about some of the common disorders that are out there that Katie so eloquently stated. But let's take a step back. Actually, I want to frame this a little bit differently. And ask this question, Dr. Johnson. Can you give us a little bit of like history a little bit, because we're talking about women's mental health in the present time, but the old saying, to know where you're going, you have to know where you came from. And so how has women's mental health evolved in this country, even 30, 40, 50 years ago, to like what's happened? Because obviously I feel like it wasn't talked about a lot. We're talking about it a lot more commonly now, but what's kind of the evolution of it? How was it like 50 years ago, 30 years ago, and how's it evolved to now? Or even and I'll ask you a second question, because why not? Because I like you so much. How's it evolved since you did your training? Whoa. All right. But let's start with a little bit of history. How is women's health addressed in the past?
I mean, it wasn't.
Okay, fair enough.
I think
zilch.
Yeah, psychiatry and behavioral health in general has come a long way, baby. Right. I think back in the day of we just didn't talk about these things, or severe disorders were kind of the only thing that were addressed, and that was usually like a really big deal. And Aunt Eugene would go off to the the farm, and it was very we just don't talk about these things, right? We never heard from her again. That's a little bit of an extreme, but you know what I mean. That was back in the day of Mother's Little Helper. Just take this pill, you'll feel better. and just get over it, right? Just keep going. Like it was also very, very frequently seen as a character flaw, right? Like, one of the things that I think has been one of the greatest changes we've had, right, is really starting to get more into the biology and the physiology of this, right? And I think there's a risk of going too far into that, right? Of like, oh, this is just a discrepancy in your serotonin. Well, it is. Why is that is a whole different, why is that true is a whole different story. But I think we've really kind of come a long way in saying like, oh, no, wait, this is a physiologic process, right? Like, it's affected by a lot of different things. There are behavioral components. There are, the way your mind thinks and the way your kind of psyche works affects your neurochemistry, right? And while part of the way we help that neurochemistry is not only through medications, right? Therapy, we have brain scans that show it changes the brain, it changes the neurochemistry. Like, all of these things are true, and we're really getting away from the idea that this is just a weakness. This is a character flaw. This is something you need to do better, right?
It's interesting you said like the flaw, and I think of the old saying, like, people say, well, you think you take mental health if you get diagnosed with it, a lot of people say, well, I take it as a total failure.
Right.
And we don't want that at all.
No.
So wow.
Yeah. To speak to your second question, actually, one of the most exciting things to me is that over the last few years, we really have started to see the influence of trauma, right? And we've really started to legitimize when things happen, they affect us on a neurochemical and physiologic level. There's a lot of really good research starting to come out about the way that the autonomic nervous system, right? So the fight or flight versus rest and digest, how that really gets out of whack when traumatic things happen, and particularly when you have kind of over and over, things happening and things happening at a young age. Like, we've moved away from this idea of PTSD as, the veterans coming home from war, and have started to realize that no, children having, insecurities in their home, or having like their mental health not addressed, or even just their emotions not addressed, can have profound physiologic effects later on. And so I'm really, really excited to see how this goes over the next few years, because I think that's the dialogue that I'm really excited to see, and that I think has evolved even since I've been in training.
This is awesome about the evolution, because again, if it's more of like acceptance, as Katie said earlier, cardiology, you have a diagnosis, we accept that. Or as you were saying, I want you to go see a kidney doctor, or a lung doctor. Yeah. It's so exciting to see that we're peeling back some of those layers, but we still have work to do. I know one of the challenges I have as a primary care doctor is my training in psychiatry was a 6-week clerkship as a third-year medical student, and that's just not enough. So certainly being on the front lines of things, we see a lot. I personally see a lot, but I'm trying to still understand more, and that's like my challenge. And I learned a lot since Katie, since you've been in our practice, to kind of teach me some of the things through the lens that you see things through. And I say, okay, well, that's how she thinks about it. Or talking to you, Dr. Johnson, it's like, okay, that's how she's thinking about it. So I can learn, but I want to be a better practitioner day in and day out. I want to be a better just human being day in and day out, and have compassion to others when they're having their challenges. So let me ask this question to Katie. I'm going to ask you the second part of the same question I asked Dr. Johnson. How have things evolved for you since you finished your training and have been in practice for a number of years? What kind of evolution have you seen?
What I've really noticed is an increase in focus on perinatal and kind of postpartum behavioral health. So when I was in getting my master's degree and doing my rotations, I don't think I ever had a ton of that information being presented. And it wasn't until actually that I was pregnant with my first child and kind of going through the process that I personally was like very interested in having that kind of insight, and then working with patients who were going through pregnancies and seeing that difference, and actually talking to perinatal doctors and seeing what they saw, and even things like the trauma of giving birth and how that impacts women. So I found that area has suddenly been given a lot of focus, which I think is incredibly important, because something that a lot of women don't know is that postpartum depression and anxiety can occur up to a year after you give birth. And so you think, okay, I've got baby blues the first couple of weeks. I get out of the 3 months. I'm not feeling anything. And then a lot of women go back to work, or, their child turns 1 year old and they start having these symptoms. And already being a mother is very stressful. So then when you have that other layer there, and so having a dialogue about it and having obstetricians really be included into that, and having all these other physicians kind of looking out for that is such an important thing. So I think that's one area I've really noticed has changed since I was in school.
Excellent. It takes a village. I want to stay on that theme about moms, because that's an important thing. A lot of our listeners are mothers, they're parents. They're also caregivers, maybe for an elderly parent. So I want to keep this conversation going. So, I came across an interesting article that was forwarded to me by my wife, and I thought it was very fascinating. So it was a recent article that was published on December 11th of last year. It was on a website called community.today.com. It's by a health a blogger named Mama's Tired. And it's about, first of all, the name is amazing, but she's blogged a lot about her own personal experiences. And so she blogged about talked about a very real but undiscussed mental health issue known as stay-at-home mom depression. And, and basically, balancing the tasks of raising children and running a household can be just tremendous, while simultaneously fending off comments that will say, "Oh, you're so lucky to be at home alone," and all that kind of stuff. And the reality is that a lot of those women will have symptoms like isolation or a loss of self, a loss of identity. What are we doing about this? How do we talk about coping? Because that's an important thing that we should be talking about. A la just like how postpartum depression, a lot of moms will stay at home with the child and lose some of that interaction. I mean, let's be honest. A lot of mothers out there were on a stay-at-home moms were on a career path. They left the workforce to raise children, and then a lot of other people started attacking that. What are we doing about this? I'll ask the question to Dr. Johnson.
Yeah.
As I'm looking at both of you, I'm like, who wants to answer the question first? Who's my guinea pig? But what are we doing about this?
I mean, I think a lot of just one of the most common things I hear is, I'm supposed to be doing X, Y, and Z, right? This is supposed to be, or this is supposed to be beautiful and I hate it, right? Like you were talking about trauma, childbirth. Childbirth is a big deal, right? And it's your body's doing a lot of things, and if it doesn't go perfectly the way you expected, or if you make a decision, I always tell my patients, right? Opinions are like armpits. Everybody has at least one. And sometimes they stink, right? So, people are very, very happy to tell you what they think you should be doing, but if they're not walking in your shoes, they don't really. I mean, you can take people's opinions, and if it works for you, great. Use it, say, thank you for that advice. This is a great idea. I'm going to do this, right? If it doesn't apply to you, it is totally okay to just be like, thank you for that. I'm going to go do what I need to do for myself, right? And I think that's part of what I think we really need to work towards, is saying, like, we can offer helpful advice, sure, whatever, but we really have to stop like deciding for other people what they need to be doing and what's supposed to be. Because we all have these internalized ideas that's like, this is supposed to be the best time of my life, and my, mama's tired.
Mama's tired,
And oh my gosh, 2-year-olds are so loud. Well, yeah, they are. And you can love your kids and still be like, could you be quiet for a minute? Right. Like, I think we really need to start. And I feel like we have started some of those dialogues of like, you know what? Motherhood is not always perfect. Womanhood is not always perfect. Right. The other thing that I hear a lot of is, and I certainly have seen this as well on a personal level. I don't have children of my own, and people have all sorts of opinions about that as well, right? And this even to we talk a lot about this in physician circles, right? About like, often in my career I've been expected to pick up the call schedule for people out on maternity leave, or you can take Christmas because you don't have kids, which personally I'm happy to, but it's not necessarily an assumption people should make,
Yeah,
right?
yeah,
And so
yes.
that idea of like, this is what you should be doing, whether it's you should be home with your kids instead of having a career. You should be, your kids should be in daycare and you should be, continuing your job. You should have kids, right? Like it really gets into that place where you start to feel like, well, whatever I pick, I'm going to pick the wrong thing.
Yeah.
Somebody's going to tell me I'm wrong.
I don't want people to second guess themselves or second guess their opinions or and you want to acknowledge certainly people that are having this. Sometimes those people may not speak up, or it might be hard for you to pick up on that. I'm hoping that people have a trusted resource that they can talk to, but I want to acknowledge that their struggles are not invalid. That I want to acknowledge that people can be cared for. And it's like with just anything, we talk about, hey, we're having this conversation. Well, people are having that conversation out there later on. We learn from experience. And so we want to have that, encourage that. I certainly, as a primary care doc, I want to encourage that discussion. But sometimes, again, people don't know where to start. Like what's like the most crucial first step is like saying that you need some help.
Yeah, absolutely. And I will say, I think there's really no substitute for kind of reaching out to your doc and saying like, hey, I need help with this. Right. Yeah. But I will say this is one place that social media can be a very, very much a double-edged sword. Right. And we all know that you can go on social media and get like, again, everybody's armpits are everywhere. And, But one of the things I really appreciate is that there are these, Facebook groups and online resources and communities. Yesterday, I saw a new mom who was like, I was so grateful to hear from some of these other moms in the community that they've had struggles like this too, because my family doesn't get it and this, that, and the other. And I'm afraid to talk to, so-and-so. And so it really has been helpful to hear that other people sometimes wish, they could just take a nap, or they have trouble getting, resources mobilized or whatever. And she's gotten really tremendous support. I mean, people, brought over diapers when she needed them and that kind of stuff. And so there are definitely, you have to be very careful about who you trust and who you listen to. And again, it's the same thing as like whoever's telling you in the grocery store that your kid should not be eating that, chocolate bar, like whatever. There's more access, I guess is what I'm trying to say, to having these conversations, especially for moms who are kind of, hindered in their ability to go to mommy and me class or to meet other people or to have, adult interaction sometimes.
Yeah. So. Well, thanks for addressing that issue. And it was interesting stat that I researched by, this is according to the Pew Research Center, that 11 million U.S. parents were not working outside of the home in the year 2016, according to an analysis of U.S. Census Bureau data. I didn't look at the breakdown on men versus women, but we would probably assume that the majority of that number is women. Katie, what else are we doing right now for women that are either suffering from postpartum or women that are suffering from stay-at-home mom, depression? What else are you doing from your perspective, from a behavioral health, a licensed clinical social worker? What are we doing for that now?
So something that I tell everyone I work with, and especially moms who are in that position, is you have to put you on the top of your priorities list. It feels completely opposite of what we're told of raising children, of taking care of the house, of putting everyone else first. But I go back to the old airplane analogy. You have to put your oxygen mask on first. You are not helping anyone if you're not helping yourself first. And it is really tough to do because I think part of just being a woman is feeling guilty, feeling that shame. And I heard you use should a lot. And I like to tell people, don't should all over yourself. Yeah. We're really good at doing that. And all it does is kind of get us stuck in these really toxic thoughts and doesn't help us be proactive. So with new moms, when you can't go anywhere, you're at home, make sure that, okay, your baby is not going to die if you put him in the crib for 20 minutes and take a shower. You're going to be okay. Put him in the little bouncy chair in the bathroom with you, but make sure that you're taking a shower. Put on lipstick, put on an outfit that you feel good in. I mean, a lot of women are also trying to deal with postpartum bodies and recovering. And there's so many different things that are going on. Our body isn't fully healed until about 2 years after childbirth. Exactly. So you got a lot that's still happening. But if you put yourself first, whatever that looks like, that can be, I'm going to do this yoga video at home. I'm going to call my girlfriend. I'm going to tell my husband, you know what? I know you've been at work, but when you get home after an hour, you're going to take the baby and be in baby duty. So whatever putting yourself as a priority first looks like, making sure that every day when you get up and look at your to-dos, you're number one.
Mm-hmm.
And so it's kind of feeding into what you're maybe trying to teach your children too. What are you modeling for the people you raise?
Absolutely. And I think that's something that, as we start to talk more and more, self-care has become a real buzzword, right?
Yeah, self-care.
And it ends up always being like, get a pedicure, and oh, absolutely. First of all, if a pedicure makes you feel good, go get a pedicure. But a lot of time what self-care actually is drawing healthy boundaries or taking time to make sure that your own kind of priorities and mental health needs are met. And, I think kind of like you said, if your cup is empty, you can't fill anybody else's, right? And
see, great minds think alike.
Great analogy.
I was gonna say that to everybody.
Awesome.
I promise.
Yeah. So I think that's a really important thing. And the other thing that people really, that I find, especially in my child and adolescent work, people really underestimate how much your kids are watching you, right? Absolutely. And how much they're, first of all, that one of the reasons I think it's so important that we're starting to talk more about postpartum is that infant bonding is significantly impacted by postpartum anxiety and depression, right? And these kids, you're really doing something for your children's well-being and your children's future to take care of yourself and make sure that you're able to mirror them and hear their needs and really engage and take care of your children. You're also modeling, one of my old colleagues used to say, we learn our role as women from our mothers, we learn our worth as women from our fathers. And so, as you're taking care of yourself, as you're making sure that you have what you need, you're showing your daughters this is okay and you need to take care of yourself. As for men, as they're treating their wives in a certain way and treating them as equals and treating them as valued partners, right? They're showing their daughters, you need to expect nothing less from your partners in the future, right? And you are worth being, a priority to someone. And I really think, as we try to get into that, like, oh no, I should be able to handle this, we're really underestimating kind of what we're passing on to our children.
Excellent. We are human, and to be human is the quintessential is that we feel. And I just love how we're able to clear the record right now and say, again, self-care is not necessarily selfish. So thank you. I mean, this is awesome. Hey, you guys been listening? You're listening right now live on Facebook.com. You're listening on IntellectualRadio.com. I'm going to change the subject a little bit because I want to talk about this concept known as mindfulness. And I'm going to have Katie O'Donnell introduce that in a second. But again, we're trying to have this conversation. Just again, how do we break down some of the barriers that are out there, but also how do we identify those individuals that may need help, that may be struggling, or if you heard some of the words that they're saying right now, they are saying you can do it. They're saying, find that resource. If you don't, find that person, trusted person, of course, credentialed person, but the resources are out there. We don't want anybody to fail. And that's why they do what they do best. They really want your best interests at hand, without a doubt. So Katie, tell us a little bit, what is mindfulness?
Mindfulness is wonderful. It's one of my favorite things in the world. Wow. So the idea behind it, because I know it is a buzzword right now, lots of people are kind of saying it. It's simply being fully present in this moment and experiencing everything that's involved in this moment without judgment and with compassion. So that means all of your emotions, your thoughts, your physical sensations, what's going around you and internally in this moment. So I think a lot of people have this idea that mindfulness is, the Dalai Lama mountain, no thoughts in there, completely zen. It's actually almost the opposite of that. When you are so fully present and aware of this moment, you are so in tune with everything that's going on. You're feeling your feet on the ground, clothing on your skin, things that your brain normally tunes out. And it helps you really be grounded in this moment, which is the only moment we can do anything with.
Dr. Johnson, how would you apply mindfulness to what we're talking about today? We've touched base on depression, we've touched base on anxiety, stress, adjustment disorder, things that a lot of women are going through. How would you apply mindfulness to these kind of things, to these kind of principles as a therapeutic option? Obviously, there's medications, there's behavioral therapy training, but how would you apply mindfulness?
One of many tools, but it's an important tool, right? I think this is a really, really helpful concept, especially for anxiety, right? Like, anxiety is so focused on the future, is so focused on what might happen, what could happen, preparing for things. People don't realize how much energy they're putting into predicting what's going to happen, right? And dealing with what could happen. And so for me, the idea of kind of coming back into the moment and saying, like, whatever's going to happen, I'm going to handle that, right? Like, I have made it to this point. I've survived everything I've been through. And like, to reclaim that energy that's being put out into, like, okay, what if this happens? What if I have to prepare for this? What if, oh my gosh, what if, like, to pull all of that energy back into what I'm doing right now is a tremendously powerful thing, right? And I feel like, again, in depression, where again, your mind sometimes is kind of lying to you, right? And getting pulled into those thoughts and all of the energy that goes into those thoughts, if you can pull that back into the moment and really direct it towards healing, that's tremendous.
It's powerful.
Yeah.
So it's interesting. I like to do some mindfulness minutes myself. And one of my things I like to do, and I'm a horrible singer, but yes, on my way to the office, am I singing at the top of my lungs in the car? The answer is yes. And it helps center me and sets the tone for me to deal with my day. And everybody makes mindfulness personal. Some people may wake up early in the morning, take a few moments to breathe, or some people may like, when was the last time you looked at the stars or whatever? Or as Katie's saying, feeling the clothes on your body, you don't normally do that. And but I just really think about setting the tone for the day. And it's so interesting how you both have made the connection on applying it to what we're talking about today on dealing with mental health and destigmatizing the challenges that women face day in and day out.
And I think one thing that's really worth talking about is people, like you said, singing in the car on the way, or just taking a moment.
I like that.
Taking a moment to center yourself. We get this idea, right, that like, oh, I have to sit and be zen for 20 minutes or it doesn't count, and there has to be like sandalwood going. No. Like, one of my favorite sort of mindfulness teachers in the past, who was a very good friend of mine, who taught like Tai Chi, things like that, right? So he said that anytime he got into his car and buckled his seatbelt, he would take 3 deep breaths, and he would repeat. He had like a phrase that he would repeat, and then he'd go on about his day, right? Like, it literally, I'll tell my patients, like, if you're in the grocery line and you can take 3 deep breaths, if you are just like, okay, like, you can take even one good solid breath, that totally counts, and it makes a huge difference, right? It's a huge difference. And the paradox of anxiety and mindfulness, right, is that like I said, you spend all this time preparing for what, and all this energy preparing for what might happen. But when you're present in the moment, you can actually deal with whatever comes so much better.
Oh
right?
my goodness, that's so awesome. Katie, what's your thoughts about just kind of using mindfulness, applying it on a daily basis or to any kind of these situations that we're talking about?
Absolutely. So the thing, and kind of going to the point about how mindfulness can be used with anxiety and depression, is anxiety definitely in the future, and depression, I'd say, more lives in the past. So when we're not being mindful and kind of stuck in a depressive thought that's more regret, ruminating on things we can't change, it can cause a lot of distress as well. So simple ways, finding a breath, finding exercise is one of my favorite ways to practice mindfulness. Think about if you're sweating or running or doing yoga, you're so physically in that moment based on what your body's doing that you don't have time to let your brain be preoccupied with all these other things. I find that a lot of people tend to struggle with racing thoughts when they're at the most vulnerable. So right before bed, or when they're trying to fall asleep, or first thing in the morning. So when you can set the tone, like you said, right when you start in the morning or right before bed, either through a few thoughts, a little quick body scan can be great. Starting from the top of your head, go down to your toes. Just notice, where am I holding tension? We tend to clench our jaws, raise our shoulders up, hold on to our fists. You can just notice that and release that. That's a great quick way to just kind of, okay, now I'm really fully in this moment. And then you're kind of physically telling your body, I'm not in danger. Another easy way to practice mindfulness is by changing how you're holding yourself. I encourage people I work with to, first thing in the morning, lay out in your bed and starfish. Just put yourself all the way out. It may feel a little weird, but what you're doing is you're exposing your vital organs. And that's really telling your body, I'm safe. My anxiety doesn't need to start coming in here because nothing's going to hurt me if I'm exposing my body like this. I'm saying I wouldn't do this if I wasn't safe. So there are a lot of little simple physical things you can do without even addressing our thoughts.
Excellent. Well, thank you for giving some good, awesome examples that are out there. I'm going to starfish tomorrow morning.
Me too.
I was just to tell my wife to just slightly slide out of the way a little bit.
Yeah, I was going to say, just make sure you're not whacking it in the head.
So mine will be like a modified starfish. I might have to do it on the ground. So it is what it is. But thank you for that example. So what I want to do right now, I want to go into the myths versus facts, because this is important. We're having some great talking today. But again, one of the reasons why I created To Your Health with Dr. G is because I want to set the record straight. Again, navigating through your health can be hard. It can be challenging. It can be uneasy. You can be nervous as well, too. But the reality is that a lot of things that we find out there, some of the resources that are out there may be misleading or blatantly false. So again, as we're talking about leveraging your credentialed practitioners, one of the things that I pride myself on is that we get the right answer the right way. So here we go. So what I'm going to do, those of you that are new to myths versus facts, I say a statement and I pick on one of my panelists. This is like going back to my days of in residency. Well, I never was a teaching attending, so I was never able to pick on people. So this is my way to get back on things getting picked on while you're doing a medical student. Yeah. So I'm going to say a statement, and then I'm going to pick on one of my panelists, my analysts. They're going to say myth or fact. They're going to give us a few. We're going to do a little speed round, myth or fact kind of thing. I got a lot of these to go through. You're going to give us a few sentences on why do you think it's a myth or a fact, and so we'll go from there. So I'm excited. Myths versus facts. Here we go. The Focusing Your Mind hashtag in the Stigma Women's Health Series. Here we go. All right. First one, Dr. Johnson, since you're sitting right next to me.
All right, bring it on.
All right. So here we go. Here's the statement. All right. Snap a rubber band on your wrist every time you have a bad thought. Is that a good thing?
I mean, if you're trying to stop biting your nails, maybe.
Okay.
Right? Like that is a technique you can use for things that are. Yeah. However, if that's not gonna fix your depression, right? Like that's I don't know if you have
I actually have a lot of thoughts about that one because I work a lot with self-injury patients. So people who do non-suicidal self-injury can use that almost as a way to sneak around if they're not actively using tools. So if I snap a rubber band, I'm just reminding myself that, but it's actually another form of punishment. Yeah. So what you're kind of associating then with your brain is I'm having this thought, I'm bad, I need to punish myself. And that can be a really slippery slope to kind of get started on.
See, so my thought on that one is, it's so funny. This is where we all get like different opinions. But my thought is that, and obviously I don't want people to, repressing your thoughts, especially if they're negative thoughts, can certainly become more and more prominent in your day-to-day. So maybe some people might just snap that rubber band. Oh my gosh, I have a bad thought, I'm gonna snap a rubber band, and then you haven't really dealt with your.
Well, and that's the part where I'm a little bit like, oh come on, and maybe I can be a little more articulate about this, right? Like if you're trying not to bite your nails and you want to be like, okay, I'm gonna give myself something else to do, cool. I'm all for it. But if you're qualifying the thoughts that I'm having are bad, that's the first errand, right? Like that's not helpful, right? So the thoughts that I'm having are what they are. Sometimes they're uncomfortable, but you have to kind of accept that whatever comes, right? And remember too, feelings aren't facts. And just because you think something, that doesn't necessarily imply that it's good or bad. It just is what it is. You're allowed to have any thought you want. Your actions, you need to be a little more careful, right?
Excellent.
But, don't bad.
All right, a lot of stuff. Stop doing it. Here we go. Here's the next statement for Katie O'Donnell. Here we go. Statement. Depression isn't real. It's something in your head or it's being lazy. Myth or fact?
Myth.
And please elaborate.
Myth. So it really does hurt my heart as a clinician when I hear patients come in and say, you hear this a lot, I feel lazy, or they've been told by loved ones that their depression and the symptoms are kind of resulting in this label. And so much with depression is there's anhedonia, which is a lack of interest in things that used to bring you pleasure, or the ability to feel pleasure, isolation. So you're not doing things, low motivation, increased fatigue. So people are sleeping all the time. So when we're associating laziness to these very real and very disruptive symptoms, it again just kind of brings on those feelings of shame and guilt. And people are less likely to then seek help and look for other options if they feel like, well, this is just an inherent character flaw, opposed to a trauma, brain chemistry, biology, all these different things that are really going on. So yes, definitely.
All right, here you go, Dr. John. Please go ahead. Yeah, please.
So there was a moment in actually one of the Harry Potter books where Harry says, I think this is all in my head. And Dumbledore says, of course it's all in your head. That doesn't mean it's not real.
Yeah.
And I frequently think like, I really should just put that on my wall, because that's the absolute truth. And what is in your head even mean? Because patients hear this all the time, right? It's in your head. Well, you know what? Your brain is in your head. Yeah. You're right. This is a brain disorder.
Excellent.
So.
Here you go, Dr. Johnson. Here's your statement. Myth or fact? I like this one. Here we go. Depression can develop in any age group, ethnic group, economic group, or gender. Myth or fact?
That is a fact.
All right, we got a fact on
that. That is a fact, and that is so important to remember. And it is important to remember too that it looks different in all of those groups, right? So I have a lot of parents come in with kids that they're irritable, or they're just arguing with me all the time, or they're so angry. And it's actually depression, right? Wow. And it presents differently in kids. It presents differently in the elderly. It, again, we talked about men and women are kind of held to different standards about how they express their emotions and what happens with their mental health. So it can look very different. There's also this whole issue with high functioning anxiety and depression. And people are like, well, you're getting to work, you're doing fine. Like you're so successful, blah, blah, blah. And the fact of the matter is people are still really struggling, and it's just as valid. So,
excellent. Here we go. Katie, myth or fact? Here we go. If a woman eats right, exercises, avoids caffeine, and lives a healthy lifestyle, her anxiety will go away. You both are like cringing at that question. You're like, oh, brother. Oh, my God.
So definitely a myth. And I think what's tough is it feeds even more into this stigma that women are told, this message that you're just not doing enough. If you just tried a little more, if you just, did the whole 30, if you just ate more kale, if you did whatever that is. And really, all those things are wonderful.
Right.
And
absolutely.
I mean, if you want a quick fix for anxiety and depression, go for a walk. Go do any kind of physical activity that'll put some endorphins going, those feel-good chemicals. That is the number one most quick and kind of effective way to, in the moment, help with symptoms. Not going to be a cure-all forever. You see triathletes, Olympians who have anxiety and depression. So when we're looking for this one quick fix or fix-all, it kind of takes away from the legitimacy of an illness, and it goes back to a character flaw. So definitely myth.
And I think we cannot say that enough, that depression, anxiety, mental illness, it's not a character flaw.
No,
it is not a failure. It is just a thing like we all deal with.
Cancer is not. High blood pressure is not.
Again, hashtag in the stigma. This is great. So here's the next one. Dr. Johnson, we'll do a couple more of these. I like this. All right, here we go. I haven't yet to ask you like one clinical question about medication, but here we go. Many people with depression are helped by medication.
That is very true.
All right.
That is very true. And, I tell my patients, right, like this is one tool in the box. You can't build a house only using a hammer, because if you ever tried to paint with a hammer, that's not going to go very well. So think about this as one tool you're using, right? It's not it's almost never the silver bullet, right? Like you take a pill, suddenly everything's amazing. You definitely want to, you want to make some of those, positive lifestyle changes. You want to make self-care a priority. You want to have a good therapist and skills that you're working on, but also, if your chemicals are out of whack, right? And you're trying to do all these things, it's like trying to get down a river without a paddle. Like you're not gonna get where you need to be. And so this is, if you think of this as your hammer, you're going to need it to frame the house. You're going to need it, but you're also going to need all these other things. It's just one piece of the puzzle. I think for a lot of people, that's a lot more palatable. The other common misconception is once you start a medication, you're on it forever, right? Sometimes that's true. Sometimes that's very important, in the same way that some diabetics have to be on insulin.
They're on it.
I'm going to be taking thyroid hormone for the rest of my life, right? Like we accept those things and there's no stigma around that. Like, okay, cool. So for some people that is true, but it's not necessarily true for everyone. A lot of times it is just a tool that you use. And when you're done with it, you put it back in the box.
Excellent. And we'll do the last myth versus facts for Katie. Here we go. Mindfulness can be practiced daily and in many ways.
Absolutely true.
Look at us with our facts.
That's a fact. I had to throw a couple of facts in there. I always throw a lot more myths on things, but no.
And I kind of tell people too, especially with mindfulness, it can be very intimidating. So you don't make it tailored to you.
Yeah.
So again, coming back to the idea, it's just about being fully in the present moment. And what's really coupled with that is acceptance. We're accepting this present moment. We're accepting how I'm feeling, what I'm getting, what I'm experiencing. And that's the tough part. But acceptance, just like so many different things we do, like I wish we could take one bite of broccoli and we're good forever. Acceptance is something we're doing every single day over and over again. So if we can just accept in this moment, I'm having a hard time. In this moment, I'm not very comfortable, but I can accept that and I can be fully present in it instead of trying to run from it, instead of trying to deny it. It can help us be more effective moving forward and also kind of get some of that power back. Like I can do something about this now if I'm accepting this as my reality.
And I think that's a really important point that, acceptance isn't just, these are the things I want to accept, right? It is absolutely okay to be uncomfortable. And I think, particularly as Americans, we kind of don't ever want to deal with discomfort, right? I don't ever want to think about being uncomfortable. But you know what? And I'm so full of cliches today. I'm sorry for this.
I like the armpit one from earlier.
The caterpillar doesn't come out of its cocoon because it's comfortable, right? The caterpillar would stay in there forever if it was comfortable, but it's when it gets to the point that staying in there becomes too uncomfortable that it actually changes, right? And so I think, that's a big deal for a lot of people, is that if you allow yourself to be like, you know what, I don't like this, you will be closer to getting to where you want to be.
Excellent. Well, hey, this has been an awesome discussion and just really talking about really some of the challenges that are out there. But I think we've really, again, I want people to take this conversation and keep it going all the time, every day. Destigmatize. We got to do better together. Hashtag end the stigma. So I'm glad that we're able to take this time today, and get some information to people. So what I want to do is I want to wrap it down. I want to get some parting thoughts from my guests. So we'll start with Katie. Katie, just give us a few tips that are out there, or things that your kind of final thoughts on how do we best hashtag in the stigma.
Absolutely. I think the first part is like what we're doing here, having this dialogue, putting yourself number one, top of your priorities list. I cannot emphasize that enough. It is so important. Also, there's so much, I think, in our history, especially with mental health, that we don't trust women to know their bodies.
Absolutely.
Or that they're the experts on their experiences.
Absolutely.
So I want to encourage women to talk about it. If you feel uncomfortable with something, if you don't agree with something, like as professionals, we're here to have a dialogue and to collaborate and be a team. We're not here to dictate. So speaking up, being assertive, and taking care of yourself.
Thanks. Dr. Johnson, give us a couple take-home points for hashtag ending the stigma. Wait, I changed the hashtag. Hashtag end the stigma. Not ending the stigma. Hashtag end the stigma.
My first tip is always know your hashtag.
Yeah, the hashtag. Yeah. Key. It's true.
But yeah, no, I think, it is a tremendously brave thing to say, this is not okay with me. Right. And I think, as we're in the era of, Me Too and Time's Up and all of those things. And I think we're starting to, like you said, trust people to talk about their own experience. And, the more that each of us can speak to our own truth, I think the stronger we're going to be as a community.
Thanks, Dr. Johnson. My final words are this, guys. This has been just a great discussion today. Be more honest about your own experiences. Realize that there are truths, as Dr. Johnson just said, there are truths that can be modeled and passed on even to the next generation, your colleagues, your friends, your daughters, the next generation of people. But there's truths that can be modeled and passed on. And lastly, we have to do this together. Having this forum like this is so important, but we have to do this together to make measurable change. So you've been listening and watching live on Facebook and IntellectualRadio.com. This episode is written by Mark Gomez and Tiffany E.R. Gomez. Producer is Tiffany E.R. Gomez. Yes. Music is by the wonderful Mr. Havis. Hey, you guys been listening? I mean, this has been a great, you know what? Next week, we're going to continue our women's health series, part 3, ideal cardiovascular health. Thanks a lot, guys. Thanks for listening. See you later, and peace out.